Hello, Susan. Now, just tell me about the treatment that you had for your BCC. So you came in, you had this thing on your leg that you'd had for a little while, and you were told it was a basal carcinoma, which, as we discussed, was a type of skin cancer, but shouldn't really be called a cancer because it doesn't spread, it's not life-threatening, it's very slow growing. And you were told by your doctors that it might need to be removed, and myself and some other doctors have discussed with you some of the options, which have been surgery or the treatment that we gave you, which was the laser treatment along with the light therapy, the PDT. What were your perspectives on the treatment that you'd had?
Well, initially I thought it was going to have to be cut out, and when I looked into that, I realised that because of the area where it was on my leg, that it was going to be quite intrusive really, because there's not a lot of fat there, and that I would possibly going to be facing a skin graft. I thought initially I wasn't really bothered about that, because it was just going to be a cosmetic mark that I was going to be left with, but then in actual fact I realised it was going to be quite substantial, and I didn't really want to have a mark like that left on my leg. So that's why I sort of explored the idea of having it lasered. And when I came to see you and found out exactly what would be involved, I realised that it was going to be great for me and far, far better. Nowhere near as intrusive and not as painful either, and that it would heal a lot more quickly. And in actual fact, having had that done with you, it's been great. It's been much better than expected. It wasn't at all painful. It was very, very quick, and the mark that I've been left with is fading literally every day.
Perfect. Well, I'm glad to hear that. I mean, clearly there are advantages and disadvantages of every type of treatment. One of the advantages of surgery is that you cut the thing out and you send it to the lab and they give you a report and the reassurance that it's been removed. From the point of view of the laser treatment and the light therapy, we rely on the historical evidence over thousands of patients that we've done to say that the chance of it coming back is only 2%. Bearing in mind that this wasn't a sort of serious type of skin cancer, were you worried about not having a lab report or it being removed or having the reassurance of that?
No, I wasn't at all. I mean, I had every confidence in what you'd said, and I've been very happy with that, and I wasn't worried about that at all, because I think, if I'd had it cut out, I was going to have quite a large area removed that was really unnecessary. So I was happy that you could actually pinpoint the exact area and deal with it very effectively.
Excellent. And one of the advantages of surgery sometimes is the fact that you remove it, and if you can sort of stitch it together, often people are worried because they may need a reconstructive flap or a skin graft, but sometimes if you can stitch it together, it's been removed and it's stitched together, and then you need stitches out in let's say 10 days or so, but then hopefully at that stage it's healed. When you have the laser treatment with the PDT, it probably took a little bit longer than that to heal, would you say?
It didn't really take too long, a couple of weeks really, and it was fine. Just had a protective plaster on, and it was absolutely fine. No pain whatsoever, and no problems with it at all.
Excellent.
Couldn't recommend it more.
Oh well, I'm pleased. And a final question, I guess, is what about the sort of cosmetic result on your leg?
It's absolutely fine. It's much better.
Should we have a look at it?
It was much better. It's much better than it was before, because before it was more unsightly and it was bleeding, and this is fading. Particularly, it's faded really a lot probably in the last 8 weeks. And if it sort of bothers me, I can always just put a little bit of foundation over it, and you just can't see it at all.